4 weeks ago, His Excellency Babajide Sanwo-Olu assumed office as the 15th governor of Lagos State. Residents have also compiled a to-do list for a vibrant healthcare sector in the next 4 years. We have details in today's package. I'm Olasumbo Modupe. Welcome to the show. As Lagos residents continue in the celebration mood after the inauguration of Babajide Sanwo-Olu as the 15th governor of the state, they have also compiled a to-do list for the new government in the area of health care delivery. Expectations are high for Governor Sanwo-Olu to surpass his predecessors, not just because of his track record in public administration, but also due to the existence of a template instituted and operated by his predecessors. For the residents, there is need for better access to quality health care and reassurance of affordable, accessible, and equitable services in the health sector. The new governor has an idea and already made a commitment since his emergence as the governorship candidate of the All Progressives Congress. His campaign promises on health included boosting the Lagos State Health Insurance Scheme to reach 500,000 households by the fourth quarter of 2019, expansion of the Lagos State Ambulance and Emergency Service coverage by increasing the number of ambulance points from 15 to 23, and having a minimum of 3 doctors, 3 nurses, and 5 community health workers in all 345 primary health care centers by 2021.
When you have just less than 20% working, then technically people don't have availability or access when they need it. And unfortunately, primary health care is the crux. That is where 80% of people need to go to when they fall ill, because we know by statistics and data that predominantly we go to hospital for primary health care services, pain and, minor ailments, malaria, typhoid, and so on and so forth. So if we can fix a primary healthcare system, which is the closest to the people, then we will make tremendous progress towards making healthcare available.
Lagos State has even gone a bit more than just the action plan, and recently they launched their biobank. They've actually got Canadian support of the Canadian government, went forward to ensure that we actually begin to have things in place to ensure that we even now can start to develop our own vaccines. If we have to depend on the WHO abroad, it's not a sustainable model. So the action plan is a first step, but beyond that now we have to begin to make investments into ensuring that it happens. Because one thing is to have the plan, another thing is to do it.
He also promised to create a Lagos Volunteer Corps to support the health sector and check medical tourism, while also delivering medical parks and giving needed support. The State University Teaching Hospital LASU to become a medical center of excellence in at least 2 specialties. Governor Sanwo-Olu also plans to increase spendings on health from 8.86% to 15% of state's annual budget.
Let's create social solutions, partnering with the private sector for economic gains for them. The budget of Lagos State on health is inadequate to take care of even one hospital. The whole budget for the year cannot take care of one hospital adequately. So let's spread this money as a rental cost for equipment to be provided, to be managed by those who provide it, and we'll pay for the service they are rendering. Let's try it. If we don't burn our fingers, we don't know where to put plaster.
First of all, they must have a political commitment, and 2, put the money where the mouth is. In other words, allocate enough funds and make sure that these funds are judiciously and properly used. I think that is it. I think the framework is good. The plan of action is good. I commend them for that. And I think more and more states should adopt that. But Lagos State is unique in the sense that it has money, it can afford to do that. But having said that, the management of that fund is also critical. So all one can say is to wish them well.
Another area residents want an intervention is the brain drain syndrome plaguing the sector. They want the government to devise means of arresting what many regard as a serious threat.
Government has tried in many aspects to understand PPP, to go into PPP. We've done road infrastructure on PPP. We've done so many things on PPP. But the area we've not really understood and we've not tried our hands on is service. We're concentrating on physical infrastructure. We need to concentrate on service. Let's buy service in health sector. We have so many equipments in the cages that were not brought out. When they were brought out, we don't have people to manage it. When they have force, we have to spend fortunes on them to bring them back to functioning.
Experts believe the state, with its huge population, should increase awareness about sexual and reproductive health rights issues, especially in the area of family planning.
We want to prove in the Bible that God said, "Go ye and multiply," and they stop at that level. They don't go else. They don't go further to expatiate more on that, and they use that to convince a lot of people. But it is wrong. God said, "Go ye and multiply." Yes, He's giving us that concept that we have to reproduce ourselves. But He doesn't say, "Go ye and just spoil the world or the earth with human beings you can't cater for." And like I used to ask people, I said, multiplication starts from what? Multiplication starts from one. So if you have one child, you have multiplied. We talk about it, everybody is free to talk about it, then it becomes round. The government too is going to take it serious, that yes, we need to vote certain things in these areas. It wouldn't be left only for the NGOs. The NGOs will come and go. Government will remain, the people remain. So government too will take it up to now make sure that things are made available for people to do. Because once it's available, you go to some clinics, no family planning and presence is fair.
If you're running a state that has the largest, in terms of challenges and opportunity, obviously there will be a lot of comments that will be made about you. And a lot of our development partners also understand that if they can get it right in Lagos, they will begin to not only reduce the challenges around poverty, but they'll be getting it right in Nigeria and by extension, sub-Saharan Africa. So it's a daunting challenge, but it's something that we're settled in, we're wired up to do, and we're believing that we'll give it a very...
Healthcare is non-negotiable. Lagosians are hopeful Governor Sanwo-Olu will bring about a new, improved sector. It's still Sound Health on Lagos Television, and today Dr. Adekemi Kiladejo, a physician with the Department Community Health and Primary Health Care, Lagos State University Teaching Hospital, will give her expertise on teething in babies. Welcome to the show, Doctor.
Thank you for having me.
Okay, in this part of the world, a school of thought says there's nothing like teething. How true is this?
Well, if we say there is nothing like teething, it only equates to mean there is nothing like children having teeth. Because teething simply means the eruption of primary teeth in children. What I mean by eruption is children bringing out teeth, their first set of teeth. So if we say there is no teething, it means we don't bring out teeth. Okay. Yeah. So there is teething.
Very good. Could the thought be attributed to myths and misconceptions held by members of the public? Some will tell you, my baby is teething because she's having fever, coughing as well, you know, diarrhea, she's experiencing diarrhea, stooling and all that.
Okay, so for every teething process, there are individual differences in the way every child responds. Like I said earlier, that teething is simply put the process of eruption, that is bringing out of teeth of children from the gums. And that's the first experience of that. And most often we have children teething from around the age of 6 months. But that's not to say there are no variations. For quite a number of children, for a few number of children, as at their 1-year-old birthday, they may not have teeth. Why for some children, as at 3 months, they start teething? But the issue is, what are the experiences that people face, that children face while teething? Most often than not, we find out that the child starts itching the gums around where the tooth is to come out. The child experiences some form of, I won't call it pain, I'll call it mild discomfort, because you know that something is coming out. So you see the child putting the hands in the mouth, trying to itch the gum. So the mother or the primary caregiver is quick to notice that this child is bringing his hand towards the mouth. Maybe the child is about teething. This could have started at about 3 months old, and the child might start the teeth coming out by 6 months old. But you see the child showing signs. Some other common symptoms are swollen gums. The gum that is to produce the teeth gets swollen. And other common symptoms are that the child wants to bite everything possible because he feels some form of itch around the place. And another symptom that we would often hear people complain about when a child is teething is fever. It's very controversial. The normal teething process has not been proven to cause fever. Research has gone into play. Wild studies have gone into play. However, when a child is teething and when a child is becoming a toddler, you see them putting their hands on the floor and putting their hands in their mouths. And in that process of putting their hands in the mouth, the person could introduce foreign organisms into the mouth, which could cause some form of mild infection. Suffice to say that the mild stress associated with teething, you might see the child having little temperature, but when the temperature starts spiking up, it is not teething. The child needs to visit a physician.
Aside from irritability, how do you distinguish teething from proper illness?
Yes, so teething is a natural process brought in by God. Is natural, and so we call that physiological. Every process that is natural, like stooling, like urinating, like salivating, those are physiological. Teething is a physiological process. It's natural. Now, illness is not physiological. It is caused by disease. The symptoms of teething usually are mild. However, in very rare cases, there could be complications. E.g., when a child is teething, it could have redness of the cheeks and some of those little common symptoms. I said it earlier on that you could have some mild temperature increase. That's what is commonly seen. But when the person has spiking fever, not being controllable by tepispongin. Tepispongin is when you take cloth and put in water and you put on the child's body. And you don't even need the fever shouldn't get that bad. Once it's getting that bad and it is persistent, then the child needs to visit the nearest hospital or a pediatrician. And most of the time, in this part of the world, because of our cultural and strong traditional beliefs, We are quick to associate anything happening to a child around the age of 6 months as teething. Some other things we see that people say their teething symptoms are diarrhea. Teething does not cause diarrhea. However, when a child puts his dirty hands in his mouth over and over again, he could introduce contaminants into the mouth, which could initiate a disease process and lead to diarrhea.
Okay. As an expert, when does the baby start teething? Is there a teething age?
Usually in medicine, we have ranges because for every child is unique in his own way. But we usually look at the most common. So most commonly, children start teething between 5 and 6 months old.
Okay.
However, I told you that a few children may not have their first teeth until after a year. Their first birthday, they have no teeth. While some, at 2 months, 3 months, they have teeth. Suffice to say that you cannot generalize and now say a child has a problem, a health condition because he toothed earlier or he toothed later. It's just like saying, when do children start to crawl? When do children start to walk? Some children walk earlier, they crawl earlier, some much later. So those, we should give the benefit of doubt. But however, if we think there is any challenge or you're sensing any problem, there is a myth that children don't visit the dentist. It is wrong. You can take your child to the dentist and get informed if the parent or caregiver feels agitated about the teething process of the child.
Okay, Dr. Kiladijo, is there an order for teething in babies? Some will tell you in the southwestern parts of Nigeria, if a baby starts teething with the incisor, the premolar, they will tell you the baby is strange. There's something strange about a baby. What's your take on this?
Like I said, the commonest way a child tooths is to start with the lower central incisors. Those are the 2 center teeth below. That's the commonest we've seen. However, we have a few group of children who choose to tooth from the top. So they have the 2 central incisors. Those are the 2 central upper teeth coming out first. And there's a common myth that, like the Yorubas will say, "Omotoba koko yoyin okay," Aburu or the maternal uncle will die early, or they believe it's bad luck. It is a myth. Myths are they're cultural beliefs that have been held on from ages to ages without any foundation, without any proofs that these things actually occur. But everyone that comes in begins to believe all of that. So we should not be quick to stigmatize children that bring out teeth, their upper teeth first. They will bring out their lower teeth and they will have their complete set of teeth. And in like 10 years, 15 years to come, can you tell me which one you came in with first?
I cannot say.
All you can say is you have teeth.
Yeah.
You have teeth.
Yes.
Yeah, so that's what matters most.
Also true. Some will tell you, okay, fine, the more reason his or her teeth or tooth are removing is because maybe he or she started teething early enough.
For everyone, every human being on the earth, it has one of the physiological process is that teething occurs as a child, and as the child is approaching about ages 5, 6 years old, he starts losing the primary teeth, which are the milk teeth, and getting the eruption of the permanent teeth. Whether you tooth earlier or tooth later, it is expected that all the milk teeth, which are also called the primary teeth, will be replaced by the permanent teeth. You have about 20 milk teeth. Eventually, we're all expected to end up having about 32 permanent teeth. So the timing of occurring eruption of the primary teeth has nothing to do with whether one will have a permanent seat or not. Everyone is expected to eventually have replaced seats.
Okay. All right, that has been Dr. Adekemi Kiladejo. She has been talking to us about how to cope with teething in babies. She's a physician with the Department of Community Health and Primary Health Care, Lagos State University Teaching Hospital. Sound Health continues with trending and home essentials. Please stay with us. This is where we say thank you on today's edition of Sound Health. Please share your thoughts with us on 08035826603 or follow us on social media at TLTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.